Hi, this is Jeff with the Wellness Keys for You, and today we are in Punta Gorda, Florida, and we are interviewing Dr. Steve Schroering, orthopedist, and we are going to talk about his approach to joint health and joint replacement. Hello, Dr. Steve.
Good afternoon.
Good afternoon. So first, thank you very much for allowing me the time to come in and talk to you about this. First, how new is the stem cell approach, and what made you choose to incorporate this option of new technology for joint replacement?
Okay, well, stem cell research has been around for a long time. And as you may recall, it became controversial because the there was a lot of push to use um, stem cells from newborn babies uh, in several different type of medical um, procedures,
Mm-hmm.
and that became very, very controversial.
Yes.
Um, but what we have been doing is what we call an autogenous stem cell transplant, which is using your own stem cells. So all the controversy goes out the window when you're talking about just using your own stem cells, and that approach is probably taken flight over, I would say, over the last 5 years, and still gaining momentum today.
Mm-hmm. And what made you choose to pick that?
Well, the there has been tremendous research. I even did it myself when I was a resident on how to repair articular cartilage. Um, our bones, the ends of our bones where they form joints, are covered with cartilage, which
Mm-hmm.
is a smooth, low friction surface. If you didn't have that when the two bones are rubbing together, then it's a high friction surface that's very, very painful.
Yes.
And and there's been research for a long, long time about how to get our bodies to repair that. We have marvelous, if not miraculous, bodies, but somehow um, there was a flaw. God was sleeping when that happened, or something. I don't know, but our bodies, once that cartilage is gone, have not been able to repair it for some reason. Um, and that's also true with other tissues in the body. But if we could find a way to do that, we could eliminate much of the arthritis in the world. And there's tremendous amount of money spent in the world and in the United States every year on treating osteoarthritis, which is the most common arthritis in the world, accounts for about 70% of the arthritis. It's just the everyday wear and tear.
Mm-hmm.
We don't actually even know what causes osteoarthritis, but it's polyfactorial, meaning there are many things that may be related to age. It can be related to a trauma. It can be
Overuse.
and just overuse, and just like I said, wear and tear.
Mm-hmm.
Um, and but if we could find something that you can inject, or a medication, or some method to cure that, it would be tremendous cost savings in dollars, but also restoring the quality of life of patients early on.
Mm-hmm.
Osteoarthritis can be a very um, significant disease that affects your quality of life, uh, especially when you're talking in the low. Osteoarthritis can affect multiple joints in the body:
Mm-hmm.
your spine, your neck, your lower back, your shoulders, elbows, wrists. I mean, just about any.
Sure.
It has a predilection for the weight bearing, like your hips and knees.
Mm-hmm.
But you can imagine, if you have that in your hips and knees, that your ability to get around is affected. Your
Sure.
ability to shop, your ability to enjoy things that gardening and golfing, or whatever sports it may be, are all affected by that. So it's
Absolutely.
been a tremendous amount of research for a long time. So here comes along stem cell research that has actually shown that these cells can can make cartilage, and that's the exciting thing about that, because there's nothing else that we have right now that can do that.
Mm-hmm. What joints of the body respond best, and which seem to be less effective for the stem cell approach?
Mm-hmm.
You know, hands or knees or hips or.
I wouldn't say it's a specific joint. Uh, it will work in any joint that has
Cartilage.
damaged cartilage.
Okay.
But I think the better question is, what factors are there about that joint that make it more responsive or less responsive? And I think it's the same as us treating the arthritic joint conservatively by say medication as it is with surgery. The more advanced that arthritis is when you begin treatment, then the prognosis is more guarded. If you can treat it early, you're going to get a better effect and a better response because there's less cartilage that's gone.
Mm-hmm.
Does that make sense? I
mean, sure. So how much rust is in the fender? You know, you need a little bit of Bondo, or you need to replace the fender.
Exactly. And you know, the most common joint, probably the most common joint that has been used in so far is in the knee, but it can be used in any arthritic joint for the ankle, for hips, elbows. I've done elbows. There are some small joints like the base of the thumb that it probably would probably not be worth using because the joint is so small. But yeah, I don't think that there's one joint that's better than others. You may be able to argue that doing the upper extremity joint may be more effective just because there's less stress on that joint,
less weight bearing,
as opposed to getting up and weight bearing constantly on a joint.
Okay. With, I guess that could be part of the answer to my next question, is with the other systems of joint replacement and their particular lifespan, because I have heard that certain joints, well, in 10 years you might need another hip replacement. Is there a lifespan with the stem cell approach?
We don't know the answer to that, but let's talk about the components that we use for hip replacement and knee replacement. It's a marvelous surgery. It really is. And in the age or population over age of 60, those joints, modern day implants today, will last 25, 30 years and longer.
Okay.
So it is a marvelous surgery that restores quality of life. But there's a lot of people that don't want surgery. There's a lot of people that can't have surgery because of their age or their medical problems. And there are those that are knowing that they're headed down a path that they're probably headed in that direction, that would like to try something that could abate the process so that they wouldn't have to have the surgery in the future. And those are the patients I think are the most interested in stem cells.
All right. Okay. Well, I think that's all the questions I have for right now. I want to thank you very much. I really appreciate your time.
Sure.
And this is Jeff signing off for Wellness Keys for You. Until next time.